You're going to have total hip replacement surgery. You may have questions or concerns about the surgery and how you will manage at home. This video will provide you with information to prepare you for your hospital stay and discharge. It will give you the general information you need to get yourself, your family, and your home ready for surgery. Patients who are prepared for surgery and who take part in their care can recover in less time and with less pain. In total hip replacement surgery, the surgeon replaces the damaged joint with an artificial joint. The head of the thigh bone is replaced with an artificial ball and stem. The sockets in your pelvis are smoothed and lined with a molded shell. Then the joint is put back together with the ball fitted into the shell. Once the new joint is in place, the muscles and ligaments are moved back into place. This is Gary. He is 65 years of age and recently had total hip replacement surgery 6 weeks ago. He has learned how to comfortably manage his daily activities while still abiding by his hip precautions. Gary was able to return to his normal daily activities after having hip surgery because he followed the hip precautions and completed all of his exercises. In this video, you will learn what precautions you will need to take with your hip movements. You will also see some adaptations you can make to help you too get back to a normal or even an improved life. Knowing what to expect after your surgery is important so you can help work toward your recovery goals. Your goals will include walking, going up and down the stairs, and completing daily activities independently. Your stay in the hospital will be short. Your home is a healthier place to recover as people tend to eat, sleep, and heal better at home. The role of the healthcare team is to get you moving as soon as possible and resume your daily activities safely. After surgery and during your stay in the surgical unit, you will be told how much weight you can put on your new joint. This can vary for each individual and is determined by the surgeon. The nurse will ask you if you are having any pain or nausea. Please tell the nurse if you have pain or nausea so he or she can give you some medication to help you feel better. You will use a commode or raised toilet seat for toileting and will be encouraged to complete your self-care activities as independently as possible. The physiotherapist or nurse will help you to stand on your new joint using a walker. As soon as you are able, you will be assisted to walk to the bathroom. The physiotherapist and occupational therapist will work with you to help you regain independence with walking and performing daily activities. After hip surgery, you will need to follow hip precautions for 3 months. These rules should be followed strictly for the first 6 weeks and carefully for the next 6 weeks following your surgery. These activity restrictions will help your joint to heal and reduce the risk of hip dislocation. There will be limits on how far you can bend your hip or bend forward at the waist. When reaching, your hands cannot go past your knees when in sitting position or standing. Instead, use a reacher to pick up items off the floor. When reaching forward, your hands cannot go past your knees. Use a reacher instead. Do not bring your legs up to your body. Instead, always sit on higher surfaces. Do not cross your legs at your knees or ankles. The crossing midline rule in mind while lying in bed. Place a pillow between your legs while sleeping to avoid crossing your legs in the middle of the night for 3 months. Do not twist your body while sitting or standing. Use a reacher instead.
My experience following surgery was the tremendous relief. Immediately after surgery, that pain was gone. In the Queensway Carleton Hospital, I received excellent help, I should say. I received good care in the hospital. The following morning after the surgery, physio came in and helped me, showed me how to get out of bed, which in my case seemed to go fairly well.
Your occupational therapist will teach you special techniques and will recommend adaptive equipment so you can perform your basic daily activities as independently as possible while following the hip precautions. Exercises are another part of your recovery. The physiotherapist will teach you exercises you will need to do before and after your surgery. By the time you come in for your surgery, you will know your exercises well enough to continue them after your surgery on your own. Even when your hip precautions are no longer required, it is still a good idea to keep completing the exercise program.
I think the exercises definitely helped in my recovery, and after about 2 weeks I started taking my walker outside. I only had one step to go down, and I would walk down the front street and back to my house, and each day I increased it a little bit, and I just felt better and better every day.
You will learn how to properly use a gait aid as prescribed by your physiotherapist. You will also learn how to walk up and down stairs. You will learn new ways to get dressed independently. For example, you may learn how to put on pants using a long-handed reacher or how to put on socks using a sock aid. After hip surgery, you will be able to get in and out of the tub safely using a tub transfer bench. You will also be able to get on and off of your toilet safely using a raised toilet seat with arm rests or an over-toilet commode. Your occupational therapist will help you decide which type of assistive devices will fit your needs.
It was quite helpful having help, and in my case, with my wife to do the main chores around the house. I would not have been able to do the laundry as I have helped with in the past. Cleaning the washroom would have been very difficult because I was not able to bend. And it was especially helpful for driving for the first 4 weeks until your surgeon says you can drive safely again. It's very helpful having someone to help you with those ongoing or regular daily chores.
After your surgery, you will need to know how to get in and out of the car. The occupational therapist or physiotherapist will instruct you on how to do this. A wedge cushion should be used to keep your hips from bending more than 90 degrees. Driving a vehicle is restricted after hip surgery. There are a number of factors that can impact your ability to safely return to driving. Please talk to your surgeon. Most people start to drive 6 weeks after surgery. Your insurance company may also have some driving guidelines post-surgery.
At first I couldn't drive at all because it was my right hip, so I was told I had to wait until the doctor approved it, which he did after 6 weeks, so that was fine. It was nice to get my independence back. But at first I had to have my children or my neighbor would pick things up or drive me here or there. And also they make the handy bus or the paratranspo available. And that's a wonderful service. That brought me to the hospital for physio and brought me wherever I had to go during that time before I could drive. It's a very good thing.
After surgery, you may need some help to complete your activities of daily living so that you don't violate your hip precautions. If you do not have family support or if you would like additional care, convalescence care should be considered.
I did make some adaptations in my home. I definitely moved all the scatter mats and scatter rugs so that I was just walking on either wall-to-wall carpeting or hardwood floors, and or you could catch your walker or your foot on the mats. And I used the tools. This was one of the tools that I had to use, and learned to use this in short order. You have to.
It is important to clear your home of dangerous obstacles. This includes putting away area rugs and removing any unnecessary cords. It is important to tuck in any long bedspread corners under the mattress. Please avoid placing any necessary items too low or too high for your reach. You can still lead a normal or even an improved life following your total hip replacement surgery. You will be able to walk independently, use the toilet by yourself, get dressed independently, and bathe without help. Be sure to follow the recommended hip precautions. Remember the 3 rules. Remember to use your reacher to avoid bending. And remember to sit on higher surfaces. Remember to use a pillow between your legs to avoid crossing. Use your reacher to avoid twisting. Returning to normal daily activity should be done with moderation. It is important to listen to your body and to not overexert your hip function too quickly.
strongest advice with anybody having hip problems, but not to be afraid to have the operation done. The tremendous relief that you get from having the operation and the short time for recovery, it's a tremendous relief to be able to go about your daily activities without very little discomfort.